So what is the nature of organizational change? So a change leader, a change leader isn't a change agent. So a change agent, you're like, what does that mean? And that's somebody who um, has taken that idea about a certain change and makes it their own, is empowered by it, and wants other people to see it. Um, and so an example of that is you want to change the way we take care of patients. So, for example, when they started bringing in the family-centered care, and that means families were there for a lot more. You involve families a lot more. Um, it was definitely, I will say right away, I was like, nope, I don't want to do that. And so it was, they had to change, they had people who were willing to be change agents to say, hear them out. This is a good idea, and I'm going to tell you why, and constantly reminding you and utilizing those new skills and showing you that it makes things better. So a change leader is someone who's a change agent, but takes that leadership responsibility to change the existing pattern. So who is responsible for saying, okay, Denise, I noticed that you didn't involve the patient's wife in the care plan. And you need to do that. And I'm going to show you how. So come in here and I'm going to show you. And let me show you why it's so beneficial. Oh, I see where you're saying the drawbacks are. How can we together fix these drawbacks? What solutions do you have? And so it's someone taking it to that next step to actually affect the change, to make other people say, yeah, this is a good change, and I'm going to do the things that they're doing so I can make the change too. So change leadership, they're forward looking. This is how it's going to improve in the future. These are the things you have to see. They're proactive. So instead of waiting for things to happen, so you are going to implement a new change and you know that this and this person is going to do this on purpose to not let the change happen. Be proactive in that. Approach them. Listen, I know for sure that you don't like the way we're doing our new bath system because you have been this amazing nurse for so long and you take pride in your baths, and that's great. So I want you specifically to be the one who trains everyone with the new equipment because I think you're just so good at this job that you could take this to the next level. And then embracing these new ideas instead of saying, it's not going to work. So change leaders, they are confident in the ability, willing to take risks. They seize opportunity. They understand that surprises are going to happen, but they still make things happen. And they promote and actively support other people. And all that leads to creativity and innovation. So someone who's a status quo manager, and that's not just saying actual managers, but someone who manages the status quo as well. They feel threatened by change. Oh, that's not going to work. We've always done it this way. Bothered by uncertainty. I just don't think it's going to happen and it's just going to ruin everything. Prefers predictability. I would rather, stick with what I know. Supports the status quo and waits for things to happen instead of making things happen. And that they avoid and discourage creativity and innovation. And people like that, it can be changed and encouraged to change. And it's definitely important to get to them before you try to implement a change. So if you know that there's someone out there who is just like, I'm not doing it, and they have to be threatened to make a change, well, that's not going to be a very sustainable change. What is the nature of organizational change? So top-down change is important, right? You need strategic and comprehensive change that's going to be initiated within the goals of comprehensive impact on the organization. So you want to change the functionality of your organization, you're going to need support from the top down, and you're going to need to see them modeling that in their area. So an organization is driven by its top leadership, and success depends on support of mid-level and lower-level workers. So if they're not feeling supported, obviously those changes are going to be harder to implement. So bottom-up change, and this is important too. I think oftentimes we forget about it, but these are initiatives for change that come from any and all parts of the organization, so not just top change. When there's a strong nurse, the nurses who started implementing Magnet, they weren't from the top. They were staff nurses who thought about all these things that they could do at the bedside because they see it. And that's not saying that your chief nursing officer is out of touch. it's just that they have so much to manage. Sometimes they're not there at the bedside. They don't see it. So it's crucial for organizational innovation. If they say we want to start doing patient and family-centered rounding, and they say, let's involve them in report. Well, it's okay to go up and say, listen, I think it's great we do rounding, but we need to have family report. We need to have nurse-to-nurse report. And then this is made possible by employee empowerment. So you're empowering your nurses to be able to say things. You're empowering your staff to be able to take initiative, involving them in plans, and then making sure they participate. So what is integrated change leadership? This is successful and enduring change, and it combines advantages of top-down and bottom-up approaches. And you're like, okay, well, what does that mean? And that means, first of all, this change lasts, right? So top-down, it breaks up traditional patterns. So open door policies. The CEO says, I am willing to listen to anybody and their ideas. Implements difficult economic adjustments. So, when things have to be cut, they think of the adjustments not just from the top down, but also from the bottom up, so that not everybody gets left out. And then bottom up change leadership builds capability for sustainable change and capability for organizational learning. So inspiring people from the top as well. All right, so unplanned change, it's a response to an unanticipated event, and it's good leaders act on opportunities for reactive change. So an example of this would be they're cutting some of the Affordable Care Act, and that was definitely unplanned. I think a lot of healthcare leaders thought this was a good sustainable thing, and it wasn't. Now it might be taken away. So responding to this unanticipated event and acting on these opportunities. Okay, so we're going to have less people insured, but now that we had more people getting health care, what did we notice in the past? Well, we noticed that referrals were still coming in from the same people. They still needed the health care, but we had less ER visits. So in order to keep those costs down from ER visits, let's keep having these clinics and offering financial restitution. And so seeing an opportunity for that reactive change. Planned change, so aligning the organization with anticipated future challenges. So knowing what's coming up in the future. We had that whole scare with Ebola. We had that whole scare with Zika. So getting organizations ready for this whole idea that we're going to have to start monitoring for more of these communicable diseases, and maybe getting a communicable disease leg ready, or training your intake staff to ask questions about travel. Activated by proactive leaders. So this planning for the future, proactive planning, is going to be activated by proactive leaders, people who understand that the way you currently perform is going to be a problem in the future. So transformational changes when you have major and comprehensive redirection. So you're changing things in a completely different way, and able to do that. And then incremental change is adjusting existing systems and practices. And, in reality, it's a little bit of both. So how to lead transformational change? So one is establishing a sense of urgency so that people jump on board. You want a group of people that are going to help lead the change. It's better to work in groups, and creating and communicating a change vision. So getting everyone on board so they share this vision. Wow, I really want to work in a place that does this, and sharing that and getting other people excited, because then people will do it. And empowering others to move forward. So empowering others to be change agents themselves and take off with that. And celebrating the short-term wins and recognizing those who help. Good job. You know what? We saw 30 more people this month than last month, and it's because of your ability to do this, and you're accommodating for that, and then building on success. You're so successful with redesigning the way we call people. I would like to add more responsibility to you if you're willing to do it and be in charge of this. Align people with systems in new ways. So you know what? You did so well with forming this one type of area, and you know that this person isn't great in another area, put them in that area full time. and stay with it. Keep people on message, keep people on point, and keep reminding them of the vision. Remember that, you know, you're going to hit ups and downs when you're implementing change. And so keeping people on message that this change is going to promote the best patient care, and it's going to promote the best environment to work as a nurse. So external forces for change, globalization. So, you know, the world gets smaller. We have more contact with other people. We can look at how other people do things. There's market competition. So we see like, hey, this group is doing this. This is how they do it. We want to do it too. Local economic conditions. You know, there's a nursing shortage and we have a lot of nursing schools. Government laws and regulations, so making sure you keep up with those. Technological developments can be, you know, help release certain barriers. Market trends, so the way the market is moving, you know, the market covers more and more certain medications, or we're going to, as little as being like there's going to be less fresh food. I mean, that idea of market trends, people are buying more exercise equipment, people are buying more Xboxes, so they're not working out as much. And then social forces and values. Then internal forces arise when change in one part of the system creates the need for change in another part of the system. So you have more nurses who want to be educated and move up, then you're going to need to fill more, create more educational roles for nurses, and maybe in response to another external force. So, you know, Mercy started offering a shot clinic. Okay, well, we're going to create a shot clinic within our organization. So organizational targets for change. So we change tasks, how people work. Actual people, we are going to hire more of this role. We're going to get rid of this role. Culture, how people actually, you know, work and think about their job. Technology, we might have to change up our technology in order to streamline what we do. And structure, you might have to reorganize the structure of things, whether it's actual physical or in terms of the organizational chart.